An 8-day-old female neonate is currently admitted to the neonatal intensive care unit for management of truncus arteriosus. Over the past day, she has developed poor feeding along with progressively increasing abdominal bloating. She was born at 39 weeks of gestation by an uncomplicated vaginal delivery and has remained hospitalized while awaiting adequate weight gain before surgical repair of her congenital heart defect. At this time, she is being fed oral formula and has already surpassed her birth weight. On physical examination, her temperature is 35.4 degrees Celsius, her blood pressure is 58/28 millimeters of mercury, her heart rate is 175 beats per minute, and her respiratory rate is 68 breaths per minute. Her oxygen saturation is 80% on room air. Clinically, she appears lethargic and cyanotic. On abdominal examination, there is moderate distension with absent bowel sounds. Bright red blood is noted in the diaper. At this point, a nasogastric tube is placed for gastric decompression and bilious contents are returned. An abdominal radiograph is then obtained. The question is, what is the most likely diagnosis in this patient? A. Clostridioides difficile colitis. B. Intussusception. C. Malrotation with midgut volvulus. D. Milk protein-induced allergic proctocolitis. E. Necrotizing enterocolitis. E. Necrotizing enterocolitis. This neonate's hypothermia, abdominal distension, bloody stools, and abnormal radiographic findings are most consistent with necrotizing enterocolitis, also known as NEC. Although NEC most commonly affects premature or very low-weight birth infants, full-term neonates may also be affected when intestinal blood flow is compromised. This can occur in the setting of cyanotic congenital heart disease or systemic hypotension, both of which are present in this patient. When intestinal perfusion is reduced, enterocytes become injured, leading to impaired nutrient absorption, mucosal inflammation, and necrosis. As the bowel wall becomes damaged, gas-forming bacteria are able to invade, resulting in the accumulation of air within the intestinal wall. Classically, necrotizing enterocolitis presents with feeding intolerance, increasing abdominal girth, bloody stools, and vomiting. These gastrointestinal findings are often preceded by nonspecific symptoms such as lethargy and instability of vital signs, including hypothermia, which are all seen in this case. The hallmark radiographic finding is pneumatosis intestinalis, which refers to air within the bowel wall. In some cases, air may also be visible within the portal venous system. Because necrotizing enterocolitis carries a high risk of progression to sepsis and shock, empiric broad-spectrum antibiotics must be started immediately. In more severe cases, bowel wall necrosis can lead to perforation and pneumoperitoneum, which requires urgent surgical intervention. Now, briefly reviewing the other answer choices. Clostridioides difficile colitis can present with abdominal distension and watery or sometimes bloody stools. However, although neonates are frequently colonized with Clostridioides difficile, they rarely develop symptomatic disease because they lack intestinal receptors for the bacterial toxins. Intussusception may also cause bloody stools, but it typically occurs in older infants between 6 months and 3 years of age. Imaging may reveal a soft tissue mass or crescent sign on X-ray, and a classic target or bullseye sign on ultrasound. Malrotation with midgut volvulus often presents in neonates with bilious vomiting and acute abdominal pain. Abdominal X-ray usually shows proximal bowel dilation with little or no gas distally due to duodenal obstruction. In contrast, the presence of pneumatosis intestinalis strongly favors necrotizing enterocolitis. Milk protein-induced allergic proctocolitis usually occurs in otherwise healthy infants between 2 weeks and 8 weeks of age and presents with blood-streaked stools. The early neonatal onset, severe systemic illness, and underlying congenital heart disease make this diagnosis unlikely. In summary, necrotizing enterocolitis should be suspected in neonates with feeding intolerance, abdominal distension, bloody stools, and temperature instability. Important risk factors include prematurity, hypotension, and congenital heart disease, and the defining radiographic feature is pneumatosis intestinalis.
Thanks for studying with me. See you in the next video.